We are wrapping up National Stroke Month, but it's not too late to raise awareness about our own risk for stroke and hear from doctors about ways we can reduce the risks as well as some new advancements in care.
For this segment of Wellness Wednesday, we are joined by SSM Health neurosurgeon and stroke physician, Dr. Mark Corriveau. Thank you so much for being here, doctor.
Thanks for having me. I appreciate it.
First, what are the signs of a stroke so our viewers can be as informed as possible?
Yeah, so there's an excellent algorithm called FAST. The F stands for face. Often you'll see drooping of one side of the face. A is for arm, meaning you can see weakness on one side of the body or the other. S is for speech. You can often notice either slurring of speech or absence or a paucity of speech. The T then, of course, is for time, which is one of the principal tenets of stroke care, indicating to call 911 right away to start treatment for a potential stroke.
And strokes have been the leading cause of disability in the U.S. over the last decade or so, but there has been an increase in successful stroke recoveries, and it's partly due to a procedure called mechanical thrombectomy. What is it and how is it improving outcomes?
So mechanical thrombectomy is a technique by which we're able to access an artery either in the leg or the wrist and send a small catheter or tube all the way from that point up to the blood vessels in the brain, and then physically remove the clot that's there, thereby restoring blood flow to that part of the brain. And there's been mounting evidence since the early 2010s such that this is essentially the standard of care now because we've seen such a dramatic improvement in patient outcomes with this technique.
So incredible advancements are being made. Can you talk a little bit about how certain medications combined with procedures like this can be even more beneficial?
Sure. So prior to this technique, strokes were primarily treated with medications. Alteplase was one, but more recently our institution and several across the country are using a similar medication called tenecteplase. And our own experience has been really fantastic with this medication. It's administered more quickly, and as we discussed, time is hugely important in stroke care. And we've seen excellent rates of blood vessels opening with just medical treatment, and we've actually seen folks neurologically doing better when they're leaving the hospital. So a very important aspect of stroke care that continues to have advancements as well.
You just mentioned how important time is. So how can calling 911 instead of driving a person to the hospital improve a stroke patient's recovery?
Yeah, so, beyond just the fact that ambulance is likely to get an individual to the hospital more quickly, what it also does critically is triggers a chain of events such that all the appropriate individuals are notified and on alert for a potential stroke treatment, including emergency department physicians, nurses, neurologists, interventionalists such as myself, and then everybody can be on standby to intervene as quickly as possible if necessary.
All right, doctor, some important information today. Thank you so much for joining us.
Yep, thank you guys. Appreciate it a lot.